Hello again. Today we're going to talk about medical practitioners. We're going to see the second part of this topic, and we're going to see the hospital staff, or you can also call it the medical staff. You can, and also this is about the UK. So in the UK, you can find four main groups of medical staff in hospitals. Okay, and remember, staff is the word that we use to refer to the people who work for an organization, any kind of organization. In this case, British hospitals in particular. So the first group of people that we have here are the pre-registrations house officer, or also PRHO, or in more common terms, you can also call them the house officer. This is basically a newly graduated doctor who is in the first year of postgraduate training. So after the 5 years that they have to study, they can become this kind of staff, which is the house officer or the PRHO. They also call it, nowadays, they also call them part of the foundation program. So they would be the FY1, which is the foundation year 1 doctor. Okay? So after they finish the 5 years of university and they are part of a hospital, they become part of the hospital staff. They begin as pre-registrations house officers, or FY1, or first foundation year 1 doctor. The second group of people that we have here is the senior house officer, or SHO. These doctors are in the second year of the foundation program, and they are also called the FY2, or foundation year 2 doctor. Okay. Then we have a special registrar, or SPR. They have completed the foundation program. So they have completed the 2-year program, and they could be training in one of different medical specialties, or they can be registrar without training. They can also be called non-training registrars. And finally, a step ahead, we have the consultant, which is a fully qualified specialist. They could be associate specialists, which are senior doctors who do not wish to be consultants, but there could be the consultant can be a medical director or clinical director. Okay, so basically we have after the 5 years of university education, we have the first year doctors, which are FY1, foundation year 1 doctor or pre-registrations house officer, the FY2, the foundation year 2 doctors or senior house officer. Once they have finished the foundation program, they could become a special registrar. If they want to do a specialty, then they could become a consultant, which is a fully qualified specialist. Then they could become the medical director. Okay. We're also going to see how medical terms are built. So a medical team, as you imagine, is a team of doctors. So now what we have here as the head of the teams are the consultants or surgeons. They are responsible for a number of patients. Okay, so each consultant or each surgeon has a team of junior doctors. The junior doctors can also, these teams can be also can be a multidisciplinary team. So these multidisciplinary teams can be made up of junior doctors and other specialists. The task of the junior doctors is basically taking medical histories. Okay, so when the patients are admitted to the hospital for the first time, they are seen by a junior doctor on the ward. The ward is a room in a hospital for a special kind of patient. So big rooms for many different patients, but they have something in common. So the junior doctor takes their medical history, and then there's a registrar who checks out the medical history and orders some investigations or tests, gives a provisional diagnosis, and begins some treatment. Then the consultant sees also new admission in the ward round. The ward round is the part of their job. Every day they have to go through the different wards and look at the different medical histories and, in this case, agree or disagree with the treatment or give some indications. So that would be a ward round. Okay. And finally, the consultants, if you remember, that was one of the highest positions in the medical team. They decide when the patients are to be discharged. Okay. Now we're going to see the shifts. Shifts, as you may already know, are the period that you have to work. That's a shift. So you can have the morning shift, the afternoon shift, or the night shift. And junior doctors usually work in shifts, which are usually 8 hours. After working these 8 hours, they are free, so they can come to work the next day at the same time. These shifts change week from week. So in 1 week, they can work the morning shift. In another week, they can work the night shift, and so on. An alternative system to working like this, 9 to 5 job, you could say, is to take turns and to be on call. So to be on call is to be available when you are needed. So if there's an emergency, then you have to be ready to take the call and go to the hospital immediately. This on-call job is based on a rota or a timetable. So basically, you are on call during some weeks. So basically what we have here is that there could be a shift that changes from week to week, or you could have a specific shift and also to be on call, which is to be available at any time that they need you. So those would be the different kinds of shifts that you can find in UK hospitals. So that's all for this topic, and see you next time.